For more than a year now, we've stayed indoors, worked from home, picked up new hobbies, spent time with our loved ones, and tried to stay sane. But one section of society came to the front line. They put on masks, donned their PPE kits, and faced the pandemic head on. The healthcare workers. We bring you 4 stories, 4 medical workers from 4 different countries.
My name is Dr. Shabir Tijani. I'm a general practitioner from Leicester, United Kingdom, and this is my story.
I'm Alyssa Newman, a midwife from Israel, and this is my story.
I am Dr. Ryan Anis, and I am a doctor from India. This is my story.
I'm Oyan Ghosh. I'm a doctor from the United States, and this is my story.
When an unusual flu first erupted in Wuhan at the end of the year, terror spread quickly, not just in China, but worldwide. For some, it brought back memories of past epidemics. For others, fear of the unknown took over. Half a world away from China, the United Kingdom was one of the hardest hit nations. There was a familiar ring to the crisis. To the old hands in the hospital, a deadly virus emanating from a faraway place was a repeat story. The SARS outbreak of 2002 was still imprinted in people's memories, but nothing could have prepared the young healthcare workers for what was going to unfold in the United Kingdom. 32-year-old Dr. Shabir Tijani has been an NHS worker in Leicester for the past 5 years. He narrates his ordeal.
When COVID-19 first came about, there was a lot of unpredictability and uncertainty with it. We as clinicians, as doctors, didn't know too much about it, neither did the scientists or the scientific community. So we had to make preparations for a very unknown phenomenon. And the way we did that is we split our surgery into 2 parts. We split the surgery into what we call the cold part and the hot part. And the hot part is where we would see patients with any COVID-like symptoms. And for that, we actually bought a porta cabin, which is like I guess you'd call it like a mobile home, which we put in our car park.
It definitely was a shock, kind of a scenario out of maybe an apocalyptic movie, you could say.
It stands out. My first interaction with a COVID patient, I was working overnight in the ICU, and it was the beginning or middle of March of 2020, and there was just this one patient who was one of the first at our hospital who had been diagnosed with COVID, and the patient was very sick and had to be brought to the ICU. And we still didn't have the sort of formal policies and guidelines in place on how to interact with the COVID patients that we did, soon after, once everything kind of picked up.
A lot of questions put to us by members of the public, by our staff members, other doctors, which we really couldn't answer because we just didn't know enough about the virus and about the disease. The honest answer is we may have seen some COVID-19 patients that we did not know had COVID-19 at the time. So I don't remember seeing my first COVID-19 patient, but I'm sure I saw a fair few in my first few weeks during this pandemic.
The pandemic has taken a silent toll on India. The entire healthcare system was brought to its knees. Medical workers were pushed to physical and mental exhaustion as they fought to keep their patients alive. There are 1.3 million doctors in India. Hospitals realized that infected patients would outnumber doctors in no time. That is when retired healthcare workers and medical students were called in to assist. 24-year-old Rahan Anis had completed his medical school at a time when India announced the world's largest nationwide lockdown. More than 1 billion were ordered to stay indoors. Anise stepped out as a doctor and was instantly pushed into a healthcare system that was in dire need of help.
You've been studying for 4.5 years, and just, you walked out in the middle of something that you've never expected. And nobody could cope with that. But we were just, we were sitting at home for a few months after our exams, and we've been watching the news, and we were just enthusiastic to get out there and start working, start doing something useful, or, to be part of something bigger than ourselves. So we were just enthusiastic at first.
The world saw the virus march on mercilessly, taking a terrible toll. Senior doctors who were more susceptible to the virus were asked to stay home. Young doctors like Anise were asked to step up, even if that meant 18-hour-long shifts and not returning home for weeks.
First COVID patient came out in India, in the state of Kerala. That's where I work. And from the start, during the months of March, it was like before even vaccines were invented. So when you have to go to work, you have literally no protection. So you are walking into an environment completely unprotected, and you couldn't just stay away from your patients. I mean, so many doctors, like most of them like seniors above the age of 70 who were still working, had to go home and not come to work. So we had to, being the younger doctors, we had to be out there at all times.
On a normal day, in pre-pandemic times, a medical worker's job is one of the most mentally taxing. Long working hours, rotating shifts, and the anxiety of someone's life depending on you. The pandemic made it worse. Imagine being in a head-to-toe plastic suit all day.
All of these rooms are full of garbage.
The kit provides a shield of protection, but this protection comes at a cost. Steam-filled masks, sweat-drenched bodysuits, and uncomfortable face shields. Healthcare workers say it was no different from wartime when everyone got into their own armor and fought a collective battle.
One case that struck me was a woman who was positive with COVID, and I was her midwife. She was alone, and I really stayed with her the entire time, from the time that she came into the room until the time that she was transferred to the postpartum unit. And it really was a special bond to try to create a sense of almost normalcy in spite of that kind of a situation. Every time you would enter a patient's room, you had to put full protective clothing on. So it was not an easy way to care for a patient, especially during a birth when you can be in the room for hours at a time. And the masks are all filled with steam, and you have to do everything that you need to do to help the baby be delivered under those conditions. Very hot, very difficult to stay in a suit for that long. I came out, it was like being in a sauna for 3 hours.
So they would wear a full body suit, FP3 masks, covered head to toe in plastic, basically. In general practice, our requirement for PPE is a mask. We were advised to wear visors as well. So we would wear a visor covering our face and then something to cover our clothing. So what I used to do was I used to just wear scrubs to work, change out of the scrubs as soon as I left the surgery, and made sure I washed or decontaminated myself when I got home. So that way I could avoid being in plastic all day and also see the patients in a safe manner.
Being inside a PPE kit, it makes you feel less human. It gives you this robotic experience that how can you touch a patient through 3 layers of plastic? You lay there, hold a patient's hands while he's dying. You give him CPR, but at the end, you feel less human. No matter how many times you've worn a PPE kit, you won't never get used to it, because you're literally, covering yourself up like a corpse, and it's a traumatizing experience. People get claustrophobic. Some of my friends actually fainted. We had nurses even vomiting in the PPE kit, and you can just take it off. You have to go through a process. It takes about 20 minutes or 30 minutes even to get out of that in the proper way. So you have to wait. So even if you vomited in that, or if you have to go use the restroom real quick, you couldn't do that.
For the millions of mothers who celebrated their first Mother's Day in 2020, their transition into motherhood occurred in the shadow of a pandemic. Alyssa Newman, a midwife in Israel, recounts the anxiety of pregnant women. Mothers-to-be had to deliver children without their loved ones around. Midwives across the world had to fill empty spaces in the delivery room. Sometimes a missing husband, sometimes a missing parent.
Say you had a woman who was positive for COVID and she was giving birth. There were certain guidelines about not allowing visitors. So that creates a real problem that she doesn't have support during the birth. And I think as a midwife, we really tried to do our utmost, in spite of the fact that we were covered with from head to toe in in a protective suit, to really have that connection with the woman, to help her through the birth and to make her feel like she was not alone.
Medical workers choose this way of life, but it would be unfeeling to overlook their services in the name of professional responsibility. For the frontline workers, it was a question of when, rather than if, they would contract the virus. An unprecedented number of doctors and nurses have lost their battle while treating patients in their fight to keep them alive. Ayun Ghosh has been working in an intensive care unit for the past 7 years and is trained to deal with loss of life, but nothing could prepare him for the magnitude of deaths that were going to unfold in front of him.
I remember I had worked overnight in the ICU at one of the community hospitals, and again, early on, it was unfortunately a lot of our older population, sicker population who were getting sick, and at the time, there just wasn't, we didn't even know that steroids would help, and for a lot of these folks, it was just too late, and there was one day where half of the ICU died overnight, and I, as an ICU doctor, I'm no stranger to death, but that day was a really hard day. I remember coming back home. My wife made us pancakes. We were listening to music and eating breakfast, and tears just started rolling down my face. It was hard to handle.
We actually had some midwives that were exposed and had to go into isolation in order to, away from their families, in order to protect them. So it's that was basically the process. You just have to kind of face the fear head on and do what you can to prevent transmission as much as possible. If you feel like you're the management of the hospital, or if they have your back and they're doing what they can to protect you, it's definitely a much different feeling coming into work, rather than the horror stories of healthcare workers that were going into hospitals where they didn't even have enough masks or enough gowns.
At the peak of the second wave, we were like, it was a usual day, and the COVID wards were almost empty, and suddenly, over a few weeks, patient load started, coming in like in hundreds and tens of patients. In my hospital, it was 200 bed capacity hospital for COVID. So it was like 200 to 150 patients being treated by 3 or 4 doctors at a time. So it was like very hectic. We couldn't get to everybody in time. And I think we lost a few lives because of that, because of the understaffed condition we had. And we were not at all prepared for that second wave.
So I think there was this very, very high level of anxiety. At the beginning, we didn't know how bad the effect of the virus was going to be, how quickly it would spread, when the first wave would hit us. We didn't know any of that. Personally speaking, my father-in-law, who isn't a healthcare worker, who I didn't actually have contact with during COVID, but he picked up COVID and he was on a ventilator for over 2 months. I know of many of my colleagues in the healthcare sector. Some of the consultants who I've worked with in the past have passed away, sadly, because of COVID-19. So there was a lot of anxiety. But I think one thing that everyone has to remember is that at the end of the day, even as doctors, even as nurses, even as healthcare professionals, we are human beings at the end of the day as well. And the pandemic has taken its toll on us physically because it's been very hard work over the last year and a half, but also mentally, it's taken a toll on a lot of the profession.
Being overworked isn't the only sacrifice the frontline workers are making. The anxiety of carrying the virus back home loomed over each day. Many lived in a dilemma, whether to save the lives of others or fear of their own. The pandemic even changed the way frontline workers return home. Alyssa Newman's 3 children wait patiently as she completes her COVID ritual.
I would call before I got home and say, okay, keep everyone away from the door. I'm going to go straight into the shower and take off my, so that was kind of my routine. That's so, and the kids, everyone kind of understood the importance of it. So, but it's very surreal when you get to that point.
My wife at the time was about 5 months pregnant, and we didn't know what this virus was, and so I needed and wanted to take all the necessary precautions. I would wear a different pair of shoes at the hospital. I would change in the car. Before leaving the hospital, I would change my scrubs, and then when I got home, I would take everything off before stepping into the apartment and run straight into the shower. So all those things I did because we were scared.
Whatever we brought with us back home, our clothing, our doctor's bags, whatever we came with, obviously there was always a risk that we may have picked something up and transmitted it to our families as well. I had to be very careful about very simple things like when I left the house, what I was wearing, when I came back into the house, what I was wearing, making sure I didn't pick my son up when I came back from work. First thing I did was go upstairs, shower, put my clothes in the wash. And that was just a ritual every single day.
But not everyone has the option to return to their loved ones at the end of a long day. Rayan Anis recalls the second wave of the pandemic in India. The Delta variant wreaked havoc as cases rose at an astounding rate. Doctors like Anis had to make a tough decision. They chose to stay away from their families in fear of bringing the virus back home.
We never went home. Most of us just stayed back in the hostels or the doctor's quarters that was provided to us. So we never went home because that is an actual risk. We had a lot of doctors, families being affected by it because they went home. So we stayed back and we tried our best to stay away from our families. We just connected through video calls. We had ourselves. We just had our fellow doctors, the colleagues, and the nurses. That was the only human interaction that we used to get. We never saw our families for a long time.
The pandemic brought an existing issue to the forefront: economic inequality. The virus didn't discriminate, but the response differed. Underdeveloped and developing countries had to fight extra hard for the basic needs. The scarcity of masks, PPE kits, and critical drugs became a common challenge. Meanwhile, richer countries like the United States were accused of hoarding. Ghosh narrates a first-hand account of how privilege plays out in today's times.
The US, we're giving away millions of dollars to try to get folks to take the vaccine, where there are millions and billions of people across the world who are literally dying to get the vaccine. And really it just boils down to just treating everybody with a sense of of equity. You know, everybody deserves the opportunity to be happy, be healthy, to get the vaccine. So I think that's one sort of reckoning that we're seeing going on right now.
Humans are social animals, and the pandemic has proved this right. The last year has unraveled the vulnerabilities of our society. Loneliness and anxiety gripped most of us, especially healthcare workers. While they struggled fighting physically to keep everyone safe, their mental health took a back seat. Emotional drain, fatigue, and headaches post-duty became common.
I've done a lot of charity work in third world countries. I've been to the south side of Iraq, and I've done work with orphanages there, refugee camps there. And that's where I came to the profession. And I never thought I would see anything that would reflect what I saw in those camps in the UK. But the pandemic has brought that, where I've seen, you know, a huge level of social isolation, people who are very sick, very vulnerable. And I feel it's been an honor and a privilege to be in a position where actually you may be the only person that someone else relies on in order to get comfort in a time of difficult mental hardship.
We have a lot of cases of ICU psychosis because all the patients are seeing is people in ICU are seeing, they are not seeing any human faces. They're just seeing masks and PPE kits, people walking around like it's a moon. So we had the case of ICU. So we even had a patient jump to his death from the COVID ward because he got so lonely.
I do the ward round in the care home once a week, and I know that a lot of elderly people who are living in the care homes, they haven't seen their relatives or their loved ones, their grandchildren for over a year now. And that in itself is really sad, because some of these elderly people have passed away because of COVID, and also not because of COVID. You know, the elderly, some of them became sick and unwell for other reasons, but they weren't able to have their loved ones around them. And that is really heartbreaking for those family members.
The pandemic brought all our lives to a standstill. Social distancing, quarantine, masks, and daily vitamins became a part of our day-to-day lives. These testing times have been tough for everyone worldwide, but tough times come with tough lessons. As Pope Francis says, the scourge of the pandemic has tested everyone and everything.
This pandemic has brought the best out of us, I think, as human beings in a lot of circumstances. And I've seen, you know, situations, even in my own surgery, I've seen a lot of our members of staff, reception staff, nursing staff, doctors, who have gone and visited elderly people just to deliver food, for example. So I've seen the worst in terms of how illness has affected society and how difficult it's been, but I've also seen the best of humankind in these last year and a half.
Mostly endurance, how we could overcome anything if we work together. And this is not a one-man thing. It's everybody is working together, even those who are at home. They are staying home, they're working from home, and even the doctors, it gets so lonely. You are not getting any human interaction. So it's a teamwork.
Our world has seen pandemics before, but our surroundings have evolved. We live on a planet that has shrunk by globalization and rapid transport. In normal times, at any given moment, there are between 8,000 and 20,000 planes in the air. But in the last year, 93% of the world's population lived in countries with travel restrictions. While most of us are waiting to pack our bags and head out, some are beginning to appreciate the small things in life.
I am going to buy a plane ticket and go back to America to visit my family. My parents and all the rest of my family are in America, so I haven't been able to go back and visit them, and that's the hardest thing, really.
The first thing I want to do is to embrace my loved ones. without fear, without a mask or without anything. Just go home. Everybody wants just to go home and embrace their loved ones and take them out. Take them out to see the world, sit in a park. The things that we used to take for granted so often.
Before the pandemic, actually, I was going to visit Portugal. So I was about to book my tickets, and then I stopped. I told myself not to book it until I saw what was going to happen. So I really want to travel abroad and just visit somewhere else and just get on a plane again.
You feel like when you're in it and you're quarantined that like, oh, I'm going to, do something crazy. I'm going to go on a trip or something like that. But it really, so it's just the small things of getting back to whatever the closest approximation to normal life is going to be.